Module 14. External stimuli, such as sexually explicit materials, can trigger arousal in both men and women. With repeated exposure, the emotional response to any erotic stimulus often lessens or habituates. Sexually coercive material tends to increase viewers' acceptance of rape and violence toward women. Images of sexually attractive men and women may lead to the devaluing of their own partners and relationships. Our imaginations are also influence sexual motivation. Wide-awake people become sexually aroused both by memories of prior sexual activities and by fantasies. About 95% of both men and women say they have had sexual fantasies. Fantasizing about sex does not indicate a sexual problem or dissatisfaction. If anything, sexually active people have more sexual fantasies. Compared with European teens, American teens have a higher pregnancy and STIs rate. One reason for this high rate is minimum communication about birth control, as many teenagers are uncomfortable discussing contraception with either parents or partners. Guilt related to sexual activity sometimes results in lack of planned birth control. When passion overwhelms intentions, the results may be conception. Sexually active teens also tend to use alcohol, which can break down normal restraints. Finally, television and movies foster sexual norms of unprotected promiscuity. Teens with high rather than average intelligence are more often likely to delay sex. Religiosity, father presence, and participation in service learning programs are also predictors of sexual restraint. Sexual orientation is our enduring sexual attraction toward members of either our own sex, homosexual orientation, the other sex, heterosexual orientation, or both sexes, bisexual orientation. Studies in both Europe and the United States suggest that about 3% of men and 1 or 2% of women are homosexual. Most psychologists today view sexual orientation as neither willfully chosen or willfully changed. Women's sexual orientation tends to be less strongly felt and potentially more fluid and changing than men's, referred to as erotic plasticity. Women are somewhat more likely than men to feel and act on bisexual attractions. There is no evidence that environmental influences determine sexual orientation. No links have been found between homosexuality and a child's relationships with parents, fear or hatred of people of the other gender, levels of sex hormones currently in the blood, or childhood sexual experience. On the other hand, biological influences are evident in studies of same-sex relations in several hundred species, straight-gay differences in body and brain characteristics, genetic studies of family members and twins, and the effects of exposure to certain hormones during critical periods of prenatal development. One of the largest reported gender differences in women's greater disapproval of and lesser willingness to engage in casual and uncommitted sex. In comparison to women, men think more about sex, masturbate more often, are more likely to initiate sex, and desire more frequent sex. Evolutionary psychologists apply the principle of natural selection to explain women's more relational and men's more recreational approaches to sex. While a woman has to take care of the child one at a time, a man can spread his genes through other females. Women most often send their genes into the future by pairing wisely, men by pairing widely. Women increase their own and children's chances of survival by searching for mates with economic resources and social status. Being attracted to healthy, fertile-appearing partners increases men's chances of spreading their genes widely. Critics argue that evolutionary psychologists start with, in effect, gender sexuality differences and work backward to propose an explanation. In addition, much of who we are is not hardwired. Cultural expectations shape the genders. Still, others suggest that evolutionary explanations may undercut moral responsibility.